This is Wedding of the Century: Prevention, Recovery, and Treatment. And so, guys, before we get started, I have to say I am a Baptist minister, so I'm used to folks saying "Amen" and definitely speaking back. So definitely use the chat box throughout today's session and speak back to me. And actually, I have an important question to begin today's session because this is Wedding of the Century. And throughout my presentation, I will be talking about, there we go. I already got an amen. Thank you. Is it Nadia? Nadia Hill, thank you. But so throughout this presentation, I will be comparing Dayton, our coalition members, to, regular Dayton when you're out there playing the field. And so the first question I have to ask consent from you for today: will you be my date? And go ahead and respond right there in the chat box. I need to know, guys, will you be my date today? I'm asking you, please be my date. Join me on this journey, this awesome journey, the wedding of the century: prevention, recovery, and treatment journey. I'm seeing yes, ma'am. Yes, of course, 110%. There you go, Chris. Certainly, yes. Okay. So I have your consent. And so, guys, let's go ahead and jump into Wedding of the Century: Prevention, Recovery, and Treatment. Again, I will be your facilitator for today, Jerria Martin, or since we're dating now, you can just call me Jay. And so let me just tell you a few fun facts about myself since we're dating. I enjoy long walks on the beach underneath the moonlit sky. I'm a professional drummer. The last group I actually played for was the Princeton University Gospel Choir because I was a student at Princeton. I received my Master's of Divinity back in 2013. So I'm also a minister, licensed minister. I'm also, I may not look like it, but I'm a rapper, y'all. Music is my love language. And I've been rapping since I was a child. I was the first woman to run for mayor in my hometown, historic Selma, Alabama. And my coalition here, Drug Free Communities of Dallas County, has over 300 awesome community partners. And did you know that 150 of those community partners make up our youth coalition? We have 150 awesome youth who we call hope dealers. And so our entire community coalition are called hope dealers, and our kids are our junior hope dealers. And I'm 32 years young, but I'm still a child, a kid at heart. And so those are some fun facts about me since we're dating. And so we have a quick poll I want to do because if you read my bio, you see that I'm also a national consultant, prevention consultant for the Opioid Response Network. And so, Brittany, if you can pull up that poll, I just want to see how many of you have heard of the Opioid Response Network. Do you guys know about that? Do you guys know about the Opioid Response Network? Have you ever worked with them? Do you know who they are? Are you familiar with the work that the Opioid Response Network does nationally or even just in your community? Let's hear back. Now, I'll give you guys some time. And Brittany can just give us an update when everybody's responded.
I think we got them all, so I'm going to go ahead and close it out. Okay. Oh, someone asked if this is the same as the state opioid response team.
Yep, the State Opioid Response Network. But then no, this is the Opioid Response Network. It's not the State Opioid Response Team. Okay, so we're about 42% is at yes, and 58% is at no. And so, guys, for those of you who have not heard about the Opioid Response Network, I strongly encourage you to look at their website. It's opioidresponsenetwork.org. But so basically, this is a grant that was granted by SAMHSA to AAAP. And so there are actually consultants, prevention, treatment, and recovery consultants in your community. All 50 states have these consultants there, and they're ready to do any type of training and prevention-based, evidence-based training on prevention, on drug prevention, and also recovery and treatment for opioid use disorders. So I definitely encourage you to check out the Opioid Response Network. And so, guys, it was with my work during the Opioid Response Network that I learned to successfully date our treatment and recovery partners. And it was also through the Opioid Response Network that I learned the significance of, when thinking about the opioid epidemic and fighting it in our community, we have to have a strong presence from our recovery and treatment partners. And I submit to you that I have had a tremendous time engaging our treatment and recovery partners here in Selma. And so we're going to talk about that today throughout my presentation, and how my work with the Opioid Response Network has definitely informed everything that we do within my coalition here in Selma. So now let's talk about dating. We talked about how I was able to learn how to successfully date our recovery and treatment partners through my work with the Opioid Response Network. But how many of you guys have actually been on a bad date? I think we have a poll for this one too. I mean, I've been telling you guys all of my business. I want to know just a little bit about you. How many of you have ever been on a bad date? And I mean, it can be bad for whatever reason. But once you answer in the poll box, I want you to type in the chat box for those who feel comfortable answering. Why did you walk away from this date? Did you walk away from it? What made it so crazy? What made this date so bad? You can use the chat box to respond to that right after you responded. Have you ever, had a bad date? As I was saying, I don't date. Okay. All right. So we have yes, 80% and no, 20%. And so for those of you who said no, we can close it out now. Thank you, Brittany. And so it was a blind date, super bad breath. Oh no, guy gave off a weird vibe, voluntary. Oh, it's been so long. She threw up on me. Oh man, these are crazy answers. Thank you guys for sharing it. But the reason that I really wanted you guys to dig in deep and think about what made for a bad date is because we don't want to show up as prevention, experts, as coalition leaders, as this person when it's time to date our coalition members. And so, guys, I remember reading an article on Psychology Today where it was just listing all of the positive attributes of being in a healthy relationship and healthy dating. And so I pulled these bullets directly from that article. And so what was really crazy was that as I was reading this article, I began to think that and make the comparison between relationships one-on-one to actually coalition building and coalition work relationships 101. So when we think about it, let's look at the first bullet. Your partner isn't afraid to challenge you. Are your coalition members afraid to challenge you? I remember the last time I was challenged was back in 2017 when we were just building up our coalition. I went to our media sector representative with our budget to do some PAs. We wanted to do some public announcements and to record some commercials with his radio station for our kids to get on and, and just put their voice out about drug prevention. And so he looked at me and said, well, Jerria, you have this magnetic personality. I love your voice. Why don't you do a radio show instead? And we'll also, on top of that, give you those radio announcements as well. And so here we are, 4 years later, we have 2 radio shows on his stations. One is the Hope Show, which comes on every second Tuesday at 9 a.m. And then we have the Junior Hope Show, which is hosted by our kids, our Junior Hope Dealers. And that's every Tuesday evening on the hip hop station. And so I wasn't afraid of being challenged, and he wasn't afraid to challenge me. So what about your coalition partners? Are they afraid to challenge you? Next, you trust one another to allow some personal space. And now this is a biggie. Think about your coalition. When you work with your coalition partners, are you the one that's always on the phone trying to track down folks who didn't make it to a coalition meeting or didn't make it to a coalition event? Or do you trust your coalition partners enough to know that when they can make it, they will make it? It's really important that you have that trust there between one another to allow that space, to allow them to also come to you when they're ready. The next, you really care about your partner's family liking you. Now, this is another biggie. I don't know how many times we can become so overjoyed that we have the superintendent as a part of our board or, as a sector representative, but we forget to further engage the teachers in that school system. We engage the hospital CEO, but forget to engage the nurses and the rest of that CEO's team. So it's really important that you're not only engaging that one sector representative, but their team, their family. You're ensuring that they support you too and that they like you. Your partner's not perfect, but think they're perfect for you. And this is another biggie. We know we're not perfect. We have differences of opinions when we get into large, groups and large gatherings. But it's really important that you know that not everyone in your coalition is going to be perfect, but they do have a perfect spot and a seat at the table, at your coalition. And as you work together, you'll find that everyone will find their perfect space within the coalition. You're one another's biggest cheerleaders. And guys, I can't tell you how many weddings and baby showers and birthday parties I've been to, just from my coalition members, just because, hey, you support our coalition. And so I want to support you too, in and out of business. You got each other's backs. Do your coalition members feel like they can call on you when they need you? And do you feel like you can call on them when needed? It's really important to have that aspect within that relationship while you're dating your coalition members. You're vulnerable with each other. This was one thing I struggled with in the past, especially coming from Princeton. You want to come across as having everything together and knowing it all, but at some times you have to be able to share those attributes that are your weaknesses, and it's in that sharing your weaknesses with your coalition members that they're able to step up and you are able to see what coalition members have that as a strength. And so it's kind of like the Mother Teresa quote, I can do things you cannot, you can do things I cannot. Together, we can do great things. And so it's very important that you're able to be vulnerable with your coalition partners. And last but not least, you make life decisions together. Now, I'm not talking about having your coalition members tell you about, advise you on your next child or your next house or major purchase, but they definitely should have a seat at the table when it comes to the life of your coalition. You should make decisions together when you're thinking about the sustainability plan, when you're thinking about your action planning. You have to make sure that they are a part of that conversation. And again, that's relationships 101. And so what I've been able to take is I was able to kind of condense all of this until just 4 steps that I advise everyone to take, not only engaging those 12 sector representatives, but specifically when engaging our treatment and recovery partners. This is what has been successful for me. The first step is know and understand your partner. And now the only way you're going to be able to really know and understand your treatment or recovery partners is by first just simply listening to them, asking them, who they are, understanding what they stand for, what excites them. And it's only then that you're able to effectively communicate your needs, because that's second. Communication is key. And so you're going to be communicating your needs, your coalition needs, while also hearing their organizational needs. What is it that you can do for them? It's kind of like what we do at the National Coalition Academy. I guess you guys remember the WIFMs, what's in it for me? So in that communication stage, you're really asking, you're asking them, what is it that you need? What is it that we can partner with, with our coalition to help your organization with? And in return, you guys can help us fill in some of the voids in our programming. So communication is key. Third, you have to be authentically you. I know with me, I'm a big kid, I'm a big child. I like to have fun. I'm always, I take my work seriously, but I don't take myself as seriously, so I come and I show up as Jerria, at all times. So you have to be authentically you when you're engaging your community partners, and specifically your treatment and recovery partners. And it's only when you understand them, you know them, you've communicated and you understand their needs, and you have that common ground where your needs meet, and you've been authentically yourself. And it's only when you've done those steps that you'll be able to sneak in and keep it spicy. And now when I say keep it spicy, this is just simply taking all the knowledge that you've received and getting to know them and communicating with them. You're able to take that knowledge and do something special to just say, I see you, and, thank you for your support. And so we're going to look at some examples of this throughout our presentation. And so dating prevention. I remember being at ORN training in Louisiana. This was one of the first trainings I did as a national consultant. And so I was actually partnered with a national treatment and a national recovery consultant as well, making this presentation. And so I remember coming in with a bag of balloons and markers, getting ready to make my part of the presentation. And my treatment and recovery partners looked at me like, now, wow, Jerria, the prevention folks get to have all the fun. And so when you think about, back with NCA, when you're attending the Coalition Academy, we actually do get to have fun in our training and fun in our learning. And we also get to have a lot of fun in our community, engaging our kids and engaging our youth and getting them to become a part of our coalition and getting them to just buy in to our drug-free mission. Dating prevention is fun. And so this right here in dating prevention is my coalition sector representatives. And so you'll see here pictured everyone from the mayor of our city to the sheriff. But the most important, the most relevant to this presentation is David McCormick. And he's the guy pictured right behind me, holding both hands up like this. And David is actually the CEO of our only hospital in Dallas County, the county in which Selma sits. He's the CEO of the hospital, and David had been on our board. He'd been sector representative for public health for about 2 years before I joined the Opioid Response Network. So I didn't even realize how I wasn't using David as a resource, in the tremendous ways that I could have. We did small things with David, like partnering with the hospital to post our literature, to hand out our opioid literature. We posted the alternative to opioid posters around, the hospital. We worked with him to ensure that the doctors there were not over prescribing opioids and only prescribing opioids, when necessary. So we were doing some work with him, but I felt like we were at the stage where we were only dating David and we weren't dating the entire, hospital. We weren't engaging the nurses. We weren't engaging the doctors at the hospital. And so what I ended up doing after attending a retreat at Forum of 2018, I had a chance to sit down at the table with treatment, recovery, and other preventionists at Forum. We had met with Triple AP and Sean Moore. Huge shout out to him, who oversees the prevention part of the Opioid Response Network. We were just sitting at the table and had an opportunity to just share and exchange ideas during forum. It was time carved out just for that. And it was just during this meeting that I was able to learn facts about like the treatment and what the doctors are going through. And one fact really stood out to me, and that was that 750,000 doctors in the US are able to prescribe opioids and addictive pain medications, but only 37,000 actually have a waiver to prescribe medicated assisted treatment, or what we call MET. And of that 37,000 people who are able to prescribe MAT, only about half of those actually do, which means that it's a major problem when those who are suffering from opioid use disorders, when only half of 37,000 doctors are actually prescribing medicated assisted treatment, which is an evidence-based practice to treat opioid use disorders. And so this was, unfortunate news. And so also with dating treatment, I came to the understanding of there not only being a waiver and people being asked to prescribed to take it MAT, but also councils and the evidence-based practice also say that you should do therapy, behavioral therapy. And so when doing behavioral therapy, we know that we had to not only partner with doctors, but also therapists. And so that's something that we're also incorporating within my coalition that I took directly from the Opioid Response Network and my dealings with them. And so now let's talk about practically, how this looked working with my coalition. And so one of the first things I did when learning this information at Forum back in 2018 was come home and speak with David. And he informed me about the residency program that he had at the hospital. And so the residency program was through UAB Family Medicine. And every year they have about 30 young doctors come through their residency program. And so one of the first things I did, and you'll see the picture on the right, is meet with a group of their top residents, the kind of the SGA of their residents. I had a meeting with them where I simply asked them, hey, what are your needs? This was our first date. And as you can see, it was at the outside in the lobby of the hospital. We had just eaten at the cafeteria there in the hospital, and just had an awesome conversation about ways that we can connect, how we can support one another. And I actually found out in this conversation that what they needed most was just to be involved in the community. And moreover, they wanted to be involved with kids, with youth. And so luckily we had over 150 junior hope dealers, and other community partners that we were able to partner them with. And so if you look at the picture to our left, you'll see Dr. O. The awesome thing about Dr. O is even during the pandemic, Dr. O had an opportunity to do all of our opioid training for our youth coalition. And so she's pictured here. This was pre-COVID, doing a training actually in the residence lounge at the hospital. The kids got to do a behind the scenes tour and actually meet in the lounge with Dr. O. And so now their residents do all of our training for opioids, not only opioids, but we also cover alcohol and marijuana. And so those doctors, the residents there, do all of our training for our youth for those substances. Also, dating treatment communication. After communicating our needs, one thing that another great partnership with the hospital that we were able to come up with was a behind the scenes tour of the emergency room. And so what was really cool about this is that you see Dr. Tisdale pictured. He had a tremendous opportunity of giving our youth coalition members behind the scenes tour of the emergency room, where he actually walked them through, the steps of what happened when someone came in with an opioid overdose or just overdose period. He was able to walk them through the steps of, what they do, and also even tell them some stories about things that happened concerning overdose within Regional Medical Center. And so our kids always enjoyed this tour. We couldn't do it last year due to COVID, but we do look forward to doing it again this year. And so dating treatment communication, on this last slide, talking about our doctors, pictured here is the staff for the residency program, the UAB Family Medicine faculty. And we were able to partner with the faculty and also with the state of Alabama to get all of the residents waived. The fee is waived for any training that they receive from the Alabama School of Substance Abuse and Medicine. And so they receive regular training, bi-monthly trainings they're registered to receive. And so now we're hoping that every year 30 new doctors, are being added to that number, of the 37,000 who have that waiver to prescribe. And so I also mentioned that we are dating our therapists. And so pictured here, we have Mrs. Wilma Pritchett. Mrs. Pritchett actually works with the Bridge program, and she's a certified addiction drug counselor. And so in my first conversation with Mrs. Pritchett, she was telling me that they were in dire need of a facility. They had just received a grant to do work in Dallas County, but didn't have a place to practice. And that was the perfect plug in for us to say, well, we have a campus at the time. We had a campus. We had a campus there. And so we took that building and gave them an office space. And so now we have a certified addiction drug counselor that works closely with us. And so what we were able to do with this, one thing I'm really proud of, what happened back in March, we were able to partner with Selma City Schools and the Bridge program and also DFC, that whenever a child was in trouble because of drugs or substance misuse, instead of being suspended or expelled, they would be recommended to attend the Bridge, where they receive counseling and the therapy needed versus being punished for that behavior. And so dating treatment communication. We've also talked about, we've also were able to partner with the COSA's addiction drug counselor. And so whenever youth come to us or families come to us with an issue that they're having with their youth, we're able to communicate with COSA's partner, who regularly comes on the radio show and talks about their services. We were able to partner with them and get them to be a part of not only our radio show, but to be a part of our community. And we're able to recommend kids to attend their programs as well. And so keeping it spicy, dating our treatment partners. One really cool thing that we had an opportunity to do, and I think it was a blessing to be able to do it, was back in February. We had one of our drug addiction counselor's husband passed away in January. And so she was talking about, how it would just really be really sad Valentine's Day without him being there. And so we thought it would be a really cool idea on Valentine's Day. We were able to partner with our local Walmart, and we simply went and delivered a flower and a chocolate, not only to that counselor, but to all of our treatment partners, just to say, thank you, just to say we see you and we appreciate the work you're doing in Selma and Dallas County to keep our drug-free mission, going on. And so the date and treatment advice that I would give you is just to make sure you're meeting all the fish and the sea. So make sure there's websites like drugrehabs.org that you can visit, and just know, those treatment providers in your area that you can have an opportunity to partner with in your own way. Remember, just simply getting to know them, seeing what voids can you fill in their program as you pinpoint the voids to fill in your own program. And so we've had tremendous success working with our community partners in the treatment area. And so one cool thing that we were able to do with our treatment partners, probably the coolest thing that I'm most proud of, is actually a music video. The kids, after looking at the data, we saw that we needed to partner more with our senior citizens, because they were the ones who had just bulk amounts of opioids in their homes. And so we did a Lock Your Pills Up campaign, and a song that I'm going to play for you guys that features our treatment partners and also our senior hope dealers.
Listen here, buddy, and you listen well. Me and my crew, we got a message to tell. The opioid epidemic is getting crazy. Lock your pills up. Let's save our babies. Opioids not good. Let me tell you why. Be like the other 100,000 and maybe die. Most people pop pills, but none of this is straight. If they knew the dangers, then they'll save by state. But now you're drug free, but you could call me now you're free. I gotta keep this energy. Can't let the negative get the best of me. I release my pay by rapping now. Opioids. It's time to prevent drugs from young girls and boys.
Pills not good, so stay away. Cause I got to go to school today. You can end up in jail or you can die. So don't let your loved ones down, alright?
I'm put on that hope, I just say no, don't need no pills. Wanna sell me chin, better think again, don't need no pills. No work for me, I'm oxy free, don't need no pills. Do as I say, let me be great, don't need no pills. Hey, lock your pills up, lock your pills up, hey, lock your pills up, lock your pills up, lock your pills up, lock your pills up, hey, lock your pills up, lock your pills up, lock. LYPU, you can call it lock. All we really trying to say is that we got you. Out here in these Selma streets, trying to live my best life, feeling hope, never double lit. That's right.
Don't pop pills, told them don't do drugs. Pills are criminals, time to lock them up. We gon' put them away, put them out of your sight. We won't see them again, like black at night. Popping pills ain't good at all. Now you overdosing, things are finna fall. Wanna lock them or just give us a call. You ain't gotta worry, we'll handle it all. Pills ain't really good, they'll kill you. You taking them cause you stressing, yeah, I feel you. It ease the pain so you think it did it heal you. But deep inside, popping pills ain't the real you.
I'm put on that hope, I just say no, don't need no pills. Wanna sell me chin, better think again, don't need no pills. No work for me, I'm oxy free, don't need no pills. Do as I say, let me be great, don't need no pills. Hey, lock your pills up, lock your pills up, hey, lock your pills up, lock your pills up, lock your pills up, lock your pills up, hey, lock your pills up, lock your pills up, lock.
All right, so that was Lock Your Pills Up. That was a song. And I definitely will. I see everybody's talking about the song. I'll share it in the chat. I'll share a link to that song. But that was Lock Your Pills Up. And I'll share that to the I'll share that to the Q&A at the end, where we will do questions at the end as well. But again, it was just a wonderful partnership that we were able to have with our treatment and are having with our treatment community. Again, we take our work seriously, but we don't take ourselves as seriously. But I think that's gonna perfect leeway into our community partners within the recovery realm. And so one of my favorite definitions of one of my favorite definitions of recovery is listed, right here. And it's all about the people in recovery being on a journey, and not just any journey, but a journey of transformation. And so when thinking about recovery, I want us to think about a story that was told to me not too long ago by a person in recovery. I'll leave their name out, but he was telling me a story about a young man who was able to bring his young son to Alabama for the first time. And he was raised on a farm, so he brought his son back on the farm, and the son had an awesome time just running around in the woods, just being a young man. But it just so happened that while he was out running around in the field, he fell into a hole. And so he looks around the hole, he tries to get himself out, and he figures out that he couldn't. So he starts to scream, he's screaming for his dad, saying, help me, please, dad, help me get out of this hole. And finally, the dad hears him and he comes over to the hole. And to the son's surprise, instead of reaching down and lifting the son up, the father hops into the hole. And so the son is looking up to his father, saying, now both of us are stuck in this hole. Why would you jump in? And the father looked to the son and he says, well, son, I've been here before. Let me show you the way out. And so, what I took from this story is that, our recovery partners have something that we, in the prevention field, will maybe never have, which is a powerful testimony that they can share to others, a powerful testimony that they can share and be that shining light to others in the community. And so, I remember sitting, I'd had to lead a coalition building presentation for the state of Alabama. And this was a recovery group. It was a peer recovery group. And at the time, I was the only person not in recovery in the room. And there were some, 100 recovery partners sitting there. And I was getting ready to lead the training. And I was actually speechless. I did not know, what was my way in to really relate to really, touch the hearts and minds of my recovery peers here today. And so as I listened to my recovery partner who was there doing his presentation, and I was right up after him, but as I listened to him share his testimony and share his story, and then the folks in the audience stand up and share their testimonies and share their recovery stories, I was so inspired that at the moment I stood up, the moment it was my turn, the first thing I had to say was, guys, this is beautiful. You are beautiful. Your stories are beautiful. And it's definitely a missing link, a missing piece of the puzzle, with our coalition. So the first thing I did when I got back home to Selma was find more recovery partners so that I too can help them, as my good friend Sharon Heseltine say, to be an ambassador of transformation. We definitely have to be ambassadors of hope, but moreover, when partnering with our recovery partners, we have to be ambassadors of transformation. And so one of the first groups I reached out to in Selma was Teen Challenge. And so Teen Challenge is actually for young men ages, I think it starts at 18 and ends all the way to about 45. And so it's a rehabilitation service for young men in recovery, and it's Christian based. And so what I was able to really identify with them with was with my faith. And so we invite them on the radio show, the Hope Show and the Junior Hope Show regularly, and they come on and share their testimonies. And guys, I mean, I may can get my kids to, stand up and have a good time and listen to, what we're saying about prevention work as a prevention specialist. But I tell you, every time we have a person from recovery stand up and talk about their valley moments and then their mountaintop moments, and to be able to see that change, that transformation, I mean, it inspires the kids and the community like never before. So I definitely encourage you to find more recovery partners and communicate with them, see what it is that they need, because all Teen Challenge needed was a way to get the word out about the awesome work that they're doing. And so we invite them on the radio show regularly to do it. And in return, they come and man, they touch the hearts and the minds and the spirits of our kids, our youth like never before. Let's use the chat box right now. And I want you guys to tell me, where am I in this picture? I bet you'll never guess where I am with these recovery partners in this picture. And I'll give you a clue. I know you see a cross. It's not church. Where do you guys think we are in this picture? Okay, hospital chapel. Nope, it's not the hospital chapel. Oh, somebody said it. Somebody said it. This here is in the Dallas County Jail. This is the chapel at the Dallas County Jail. And can you believe that some of our, my most meaningful relationships when dating recovery has been at the Dallas County Jail. Pictured here, are just some young women who, all they needed, when having that conversation about their, their needs and their wants, was just someone to come in and pray with them, someone to come in and give them hope on the regular. And in return, guys, I mean, they have given us so much information. We've actually worked out a deal with our sheriff where we're able to share data that they give us, important information that they give us about drugs, out in the community. We're able to give them locations. We're even able to give names in a super discreet, way. And so they have been a huge, huge blessing to our coalition and also to the community at large. And I bet you will never guess it, but it's really important that we not only partner with those who are in long-term recovery, who have been in recovery for 10 years, but what about those who been in recovery for 10 days or maybe even 10 hours, in some cases. But this has definitely been my ministry at the Dallas County Jail, has definitely encouraged my work as a coalition leader. And I see them, those women, as hope dealers as well, because again, they're able to just give us so much data. And just meaningful, and useful information that we can use both in our community and within our coalition. And so here, you guys remember me saying that we had the Bridge, that we partnered with the Bridge organization. And so a cool thing about having them housed, right within the facility with us is that we get to have those youth one day out of a week. And if you see us, pictured here, I'm able to develop a relationship with them. So sometimes, they come to my office, sit on a beanbag, we play cards. But I think probably the most meaningful thing we've done with our youth thus far, if you see in the picture, they're holding letters. And I bet you can't guess who sent them those letters. I'll let you take a few guesses. Who do you think sent the letters that our youth have? Nope, not parents. Well, they could be parents, but it's not their parents. They're incarcerated. The people in jail, those who are in recovery in jail, took the time, from their hearts, right into these young people, to our, young people who are facing that same struggle. And so they almost have like pen pals where they're able to write to each other and to encourage one another. And again, it's just all in, good dating. And so I definitely encourage you guys to, seek out your recovery partners within your community. Again, I can't stress it enough. And we're doing a play on words with saying dating, but it's really just seeking out, those community partners in the treatment and also recovery world, and just again seeing, how can we connect? How can we help further each other's mission? And so with our youth pictured here in the bridge, once they finish the bridge program and go back to school, we actually do make them a part of our Junior Hope Dealers program. So it's not just our star students that are Junior Hope Dealers. It's also our students who are struggling, who maybe even already have substance use disorders or opioid use disorders. These are the kids that we work with to bring hope, and that's why we call ourselves hope dealers. And so the kids from the bridge too, we do focus groups with them. We've worked to really gain their trust, just like how I work to, gain the trust of the women in the Dallas County Jail. But I was really able to just connect with them, and they also share data, important data for our grant, and again identifying and plugging in information in our logic models, understanding where kids are actually getting the drugs from, or who should be arrested, because we have close partnerships with the Alabama Law Enforcement Agency, with the Selma Police Department, with the Dallas County Sheriff's Department. We're able to just pull all our resources together to combat the opioid epidemic within our communities. And so keeping it spicy, dating recovery. Something that, if you guys remember back at the beginning of our presentation, I spoke to you guys about music being my love language. And so one thing that I did for the recovery community was write a song. After just listening through all their struggles and everything that they have to face on their day-to-day walk, on their journey of transformation, listening to their low points, listening to what really makes them tick, and the stigma that they face. That I can't stress that enough. A lot of them, face stigma on a daily, where they're called names, where the kids who are told that, they're going to turn out to be just like their fathers, or just like their mothers. And I just really didn't realize the struggles that they go to on a day, and to actually dating them, to actually getting a chance to hear their stories and understand their needs. And so I took all of that information that I received from them and wrote a song. And the name of the song is Butterflies. And so we actually shot the video to the song last month. And so definitely look for the video on our Facebook page, Drug Free Communities of Dallas County. We'll release that within the next month and a half. And I hope you guys will support it. But if you guys don't mind, I would love to perform that song as a spoken word piece for you. So let me know, do I have your permission to move forward with my spoken word piece titled Butterflies? All right, we have yes, 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 ma'am. Okay. All right. So again, the name of this spoken word piece is Butterflies. I am not my habit. What would it take for the world to understand it? People look at me, but it's a shame that they see all my faults and failures, not my hopes and dreams. You gave up on me a long time ago. That's why I don't really even come around no more. I'm shattered. I'm broken. You can see it in my eyes. This time last year, I didn't want to be alive. Never felt good enough. Always felt like a disappointment. Overindulgence is a sin. How can I be anointed? I prayed to God that he would take the pain away. But now I understand my past doesn't define today because I'm forgiven. So I give him all my praise. But there's still people who look at me sideways, acting like I'm not worthy. It's not sticks and stones, it's your words that hurt me. Please don't desert me. My soul always cried out, but your spirit never heard me. But if you need me, I'll still be there in a hurry because I am not a junkie or a fiend or an addict. If you feel me, scream it loud. I am not my habit. Cocoons transform to butterflies. I am not my habit. Please support, don't stigmatize because it's not a habit. They say your words become your actions and your actions your habits. So I encourage myself, respect, I demand it. Yeah, because change starts within. How can you stigmatize me, then call me friend? No, I'm not the person that I used to be. Now that I know that my struggle is a SUD. Don't know what that is? Then look it up, please. Maybe you'll understand. It's not a habit, it's a disease. And all I needed was a proper treatment from family, friends, and doctors, support I could believe in. Don't need nobody calling me names with preconceived notions and silly mind games. I define who I am. God knows what I'll be. Understand that my past is not my destiny. May not be there yet, but I'm on my way. Shout out to every person in recovery. It's going to be okay because cocoons transform to butterflies. I am not my habit. Please support, don't stigmatize because it's not a habit. Thank you. And so guys, that was a piece, man, that I pulled together after just listening to the voices, after listening to, the words, especially at the beginning. That's the words from our youth. I've had young people in recovery look at me and tell me that they felt, like they were nothing. They felt completely hopeless. They felt like all hope was gone. So this song was just another way to keep it spicy. It was another way to make them see their beauty, to see that light within. And so we're definitely on the word on the road to transformation, and I enjoy being on the road with them every step of the way. And so my advice for when you're working with your recovery partners is to simply meet them where they are and then sit there with them. So meet them where they are. Again, if they're 10 days in recovery or 10 years, meet them exactly where they are. Learn their concerns, learn their needs, learn their wants, be that listening ear, support them. And I promise you, they will be your biggest supporter for life. I mean, I know if I ever need someone to volunteer at a coalition event, dude, I'm always calling your teen challenge. I'm always calling our youth who are in the bridge, program to come out and volunteer with me so that I can find time to speak words of hope and words of wisdom into them. So definitely to just bring it all, together. Just remember that when you're targeting and reaching and dating our treatment and recovery partners, to just let your heart, do the work. Or just communicate your needs, understand theirs, and not, I'm telling you, there's all types of ways that you can come together and partner and really make some meaningful transformation and do some meaningful work in your communities. Okay, and so now we have time for questions. We'll leave about 15 minutes because we do have about a 5-minute poll to do at the end that we'll close out with, but we'll take the next, I guess, 15 minutes or so for questions.
Yeah, Jerria, thank you so much for the information that you shared, but also for sharing that that spoken word. It is amazing. And
Thank you.
I know we had talked a little bit before, and that was wonderful. Thank you so much for sharing.
Thank you.
So some of the questions that we have in the Q&A box. So somebody asked, could you share a link to the Hope Show? They thought it would be interesting to check out.
Oh, sure. Well, I can do that right now. I'll pull up our Facebook page. It's actually live on Facebook, so you can watch it. You can actually tune in and watch it every second Tuesday at 7 a.m. And you can actually go back and see the other ones. Let me pull it up on Facebook.
And then somebody else had asked if you have a newsletter, and so I'm just going to assume that if you do, they could also get it from from the coalition's Facebook page.
We actually don't have a newsletter, but that's definitely a good idea.
But Nadia, you can always follow them on Facebook as well, and
that's really big in our area, Facebook. So I'm pulling up our Facebook page, and I'm going to share that link into the box if it'll click. Oh, here we are. All right, I'm going to share that with you guys.
And somebody else had asked, what if you don't feel smart or qualified enough? Trainings help, but talking points or lesson plan styled information would be beneficial.
Right. And so that's where it really comes with, man, being yourself, because remember, you can't fake it. I mean, think about if someone came over to talk to you at a table, if you had talking points, to meet your friend for dinner, did you say, well, Stephanie, I really wanted to cover, the news today. I wanted to talk about the weather, or do you say, well, hey, how's the weather outside? Or hey, did you catch the news the other day? So you just really, my best advice is to be as genuine as you can. And I mean, for me, I just try to treat it like friendships. I called it dating, but you treat it like all your community partners are your friends. And when you have a new community partner coming in that you're dating or that you prospectively looking at, you definitely want to come in as a friend first.
I'm looking through the chat. I thought I had saw some earlier questions that didn't make it into the Q&A box, but I don't think they did. I think somebody had asked if there was a YouTube link for the
the video.
For the video.
Right.
Yes.
I'll put that into the link. And hopefully everybody in the chat box, I put our Facebook link and you can check out those there. Let me go back to YouTube and I'll put in the link to that. And so if you check out our YouTube page, we actually have about 4 other viral videos, and our biggest video to date has over 150,000 views between YouTube and Facebook.
So Catherine had asked in the chat box, how do you recruit your hope dealers?
And so hope dealers, and that's a great question. So we partner with all schools, high schools and middle schools within Selma and Dallas County. So every school has a junior hope dealers group. And it's sort of like, they're the peer leaders, they're the, kind of SGA of the school. And so we partner with them. And every school actually has a hope advisor too, whether that's a teacher or a counselor who oversees that youth group within the school. And so each hope dealer group has between 15 to 20 students. And so every year we come in at the beginning of the year to do drug-free trainings. So we spend that first maybe month and a half doing all trainings. Then the rest of the year, they're able to take that information back and do cool events in the school. They have drug-free pep rallies, drug-free talent shows, drug-free, you name it. If they come up with it, we try to support them to do it within their schools.
Awesome. I'm looking, not seeing any other questions that are coming through, so please feel free to put them in. Somebody is asking for the Facebook link again, but I will make sure that they get that information. If there are other questions, feel free to put them in the chat box right now or to put them in the Q&A box. Either one we are monitoring. Somebody asked, are Facebook and YouTube the most popular online resources?
And so for us, that's a really great question. Another presentation that I do is actually on social media and especially engaging youth in social media. And one thing you have to know is where your youth are and where your community is, what type of online presence they have. And so for us, with us being in the South and we're really rural, most of our kids are on specifically Facebook, and our community members are on Facebook and YouTube. And that's why we get most of our views through. We actually do have Instagram and Twitter pages, but if you look at it, the difference between the engagement in our YouTube and Facebook is tremendously higher than our engagement from Twitter and Instagram. But it's just, that's our culture here being a small town. And not a lot of kids have smartphones, so they're not able to, do the Instagram and the Snapchat and so the best programming for us to use and the platform for us to use has been Facebook. I know TikTok is huge again, but again, you have to remember we're living in an area in Dallas County where 1 in 3 kids are in poverty. And so again, you just have to know the culture.
Somebody asked, do you have guidelines and operating procedures for posting to social media, especially the videos?
I wouldn't say necessarily guidelines or operating, procedures, but I can say, if there's any procedures or guidelines is that everything that we post is always, if it's not done by our youth, it always goes through our youth. So there are advisors when it comes to posting on social media. We have a youth committee, a youth PR committee that comes up with our daily posts and also do our daily shares. But in our videos, they're always informed specifically by our youth because we want to make sure that it's reaching them and, and their friends in their age group.
Yeah, and so I guess one of the things that I'll say is if you kind of have questions around social media generally, we did a webinar in March with our communications team that did talk about social media. So they talked to some of that social media work as well, working with Facebook, with Twitter, with Instagram, with YouTube. They didn't touch a whole lot on TikTok. They talked a little bit more about some of the more the larger ones, but we know TikTok is becoming a bigger app to use in that social media field. So I would encourage you, if you have questions about social media not social media generally, you can always check out that webinar as well. That is posted on the Webinar Wednesday page. Any other questions that are coming through, or that people want to ask before we end here for the day and move over to the community? Okay, I haven't seen any new questions come in, so I think, oh, somebody wanted to know if the butterfly song was on Facebook or coming soon.
So Butterflies, the song has been recorded, but we are now shooting a video. We shot the video, and so it's just in production. And so within, and this is actually one of the first videos that we've done. It's going to be a short film. So it's both a music video and short film telling a recovery story. And so it's going to be really cool. Our kids, again, put it together, and they're the actors in this short film. And so I definitely look on just continue checking our social media pages. But we're looking to put this out within the next month and a half.
That's awesome and so exciting. And that'll be posted to the Facebook page then, you said?
Yeah, we'll put it on YouTube and Facebook.
Great. So the Facebook link for the DFC Coalition is there in the chat box, so you can find it and you can start following them, and you can find it there then when it goes live. Jerria, thank you so much for joining us today. I did put in the chat box a link to the evaluation, so please make sure to fill that out. But if there aren't any other questions that have come in, please feel free to join us over in the CADCA community, and I will put a link to join us there as well. And we'll be having a conversation with Jerria, just a larger conversation, more interactive. You can kind of chat back and forth a little bit more, ask more questions. But Jerria, thank you again so much for being here and for sharing your information and for sharing that spoken word as well. That was really great and powerful.
Thank you.
All right, everyone, have a wonderful Wednesday, and we will see you, hope to see you all at mid-year and then at other webinar Wednesdays that we have coming up in both August and September. Have a great day.